A few months ago, Dr. Jeffrey Rawnsley issued the Real Face of Rhinoplasty Challenge.
The response to our Real Face Challenge was incredible. We received submissions from all over the country. It was really great to hear so many different stories from so many different people. But there was one story that just stood out above all the rest.
My nose has been a target for verbal and emotional stress over probably the last 10 years of my life.
I chose Brittany because her story just epitomized all the great things I hear from my patients all the time about why they want rhinoplasty. And having seen her entry, I knew that rhinoplasty would have a profound effect on her life, both emotionally and physically. And once I decided that it was going to be her, I was so excited to call her up and actually tell her that she had won.
I got the phone call that I was the winner. I cried, I yelled, I screamed. I was on the phone with Dr. Rawnsley, yelling and screaming. I'm driving down the road.
As her surgery got closer, Brittany had a lot of very common concerns that most people have about their procedure.
One of the things that I was worried about, that I am kind of worried about, that I think anyone would be concerned with is having cosmetic surgery done and then coming out of there looking like you've had cosmetic surgery. And a lot of times when people get nose jobs, it's like they look really scary.
This is a very common concern that every patient has. I told Brittany that we're trying to make her face look better. We're not trying to make her look radically different. We're just trying to give her the nose that gives her the most balanced appearance.
We all want to change little things about ourselves, and I think if I can just do it in a way that it's subtle and soft, but enough to make me look in the mirror and feel happy with what I've done, then I think it's going to be a really positive experience.
The week before my surgery, I was really excited, but also nervous.
I am feeling like I don't know what to do with myself.
2 days before my surgery, I traveled with my mom and my family from Iowa to Dr. Rawnsley's office in Los Angeles. When I finally got to meet Dr. Rawnsley, I knew right away that I was in good hands. Dr. Rawnsley really helped to keep my nerves at bay. I asked him a lot of questions about what to expect, and he's very knowledgeable and he's very smart, and you can tell that this is just something that comes very natural to him, and it's something that he does all the time. So his confidence is very reassuring for somebody who has never had cosmetic surgery before.
Before her surgery, I was able to take some pictures of Brittany and do some digital imaging to give her some idea of what my vision was for her and also get some feedback from her about what she wanted. That way, Brittany and I together could really agree upon the perfect nose that would look great for her face.
I was able to describe to him the type of nose that I've always wanted, and he was able to lay it out for me right in front of my face. It's really amazing to be able to look at a computer screen and see this digitalized portrait of myself, knowing that I'm going to look like that. I knew what I was going to look like, and he knew what I was going to look like, and then immediately there was this level of trust and comfort that I could have in somebody that I was going to be a patient of. The digital imaging that Dr. Rawnsley did looks identical to my nose now. The morning of my procedure, I was a little nervous because it's kind of a big deal, but I felt like I was in the hands of the best surgeon possible. Dr. Rawnsley was really relaxed the morning of my procedure, and I think when somebody comes in to a room and their demeanor is very calm, it kind of sets the tone, for everyone. It was a really good feeling when you can visibly see that somebody is just confident in themselves and very reassuring to the people around them. It just makes somebody feel a million times better.
After a very successful surgery, Brittany was required to wear a cast on her nose for about a week. And like a lot of other patients, she had some concerns about pain and discomfort.
I wouldn't even really describe having your nose done as it being painful, because I've had things that are painful, and it just surprised me that the soft tissue, on the inside was the area where I would say was the most discomfort, but I took Tylenol the entire time and I was fine.
I had to keep the cast on for 1 week, And the day that I came in, and even though I knew it was going to look good, I was really nervous. When Dr. Rawnsley took the cast off, I was in awe.
Perfect. Absolutely perfect.
It's like there it was. There was my nose that I had always wanted, and I knew that in my head it was only going to keep getting better. What Dr. Rawnsley did actually was very subtle, and it was a very small fix of my nose. Dr. Rawnsley is definitely an artist. I feel like it's just complete harmony, for my face. When I look in the mirror, I see me, and I see the Brittany that I've always wanted to see, and the Brittany that I have felt like I have been on the inside for a really long time. I wake up in the morning and I look in the mirror and I feel beautiful. And now it's like I feel like I don't have anything holding me back.